Hello, this is Dr. Athaullaa, Senior Consultant Physician from Care Hospitals, Malakpet. Today I would like to talk to you about an important problem which we are seeing increasingly these days, that is the metabolic syndrome. So you might have heard this word metabolic syndrome in the newspapers, in the media, or even in the television. The metabolic syndrome is nothing but it's a form of a non-communicable disease. So as we are entering into the 21st century, we are seeing more and more cases of metabolic syndrome. So what does this metabolic syndrome constitute? It constitutes various diseases like obesity, diabetes mellitus, hypertension, dyslipidemia, which is nothing but altered lipid levels in the blood. Particularly, there is an important fraction called triglycerides. So these triglycerides are also increased in the blood, and some of the other diseases like liver diseases like non-alcoholic fatty liver disease and even non-alcoholic steatohepatitis. Why these diseases are extremely important? These are extremely important because these constellation of diseases leads to cardiovascular morbidity and mortality. So what do you mean by cardiovascular morbidity and mortality? Here you see excess of heart attacks like myocardial infarctions like heart attacks and all those things you see much more common in these people. These people also have high incidence of paralytic attacks like cerebrovascular accidents and also peripheral vascular disease, where there is obstruction to the blood vessels flowing through the arteries of the legs. These are important things because they can cause premature death in people. We are all seeing that many celebrities are dying at young age, so we should be extremely careful as to avoid these unnecessary deaths by controlling our blood sugars, by controlling hypertension, by taking care of the lipids, by reducing the body weight and keeping the body mass index to an appropriate level of less than 23, seeing that your waist circumference does not increase beyond 80 centimeters in men, beyond 80 centimeters in women, and 90 centimeters in women. So how do you address these problems? So for which the most important thing is dietary restrictions. So you have to consume lots of fruits and vegetables, number one. Number two, if you are found to have diabetes, come to us at Care Hospitals, Malakpet. We will be helping you by screening whether you have diabetes or not. Or if you already have diabetes, what we can do is we can modify your treatment and also evaluate whether you have any complications in the form of eye disease, heart disease, kidney disease, or even neurological disease. This is one. Number two, hypertension should be meticulously controlled. Number three, the cholesterol levels, particularly the LDL cholesterol, which is supposed to be the more dangerous cholesterol, we have extremely good drugs available in the form of statins, and also a new drug has come into the market called bempedoic acid. So we can use these drugs and bring your LDL cholesterol to extremely low levels of 55 or even less than 60. So this is one. And number four, I told you obesity should be addressed in the form of lifestyle modification, changing in dietary habits. Consumption of excessive fruits and vegetables is extremely good for health. Going for a brisk walk at least half an hour per day or 150 minutes per week is extremely important. And reduction of weight of 1 to 2 kgs a month is also very, very helpful. The other things which are of little more, some more importance are uric acid levels, which is also supposed to be one of the important risk factor for cardiac disease as well as the kidney disease. So these patients who have metabolic syndrome are at a very high risk of having heart problems, kidney problems, as well as cerebrovascular problems. So what I would like to advise is come to us at Care Hospitals, get evaluated for yourself for these metabolic problems and get treated both by dietary restrictions, that is lifestyle modifications, and there are good drugs which have come into the market which may help you to control your other risk factors of metabolic syndrome. Thank you very much for a patient hearing.